She switched. All right, so I've had unprotected sex. Let's see what we have here. This is an important question, all right, because we'll see what the answers are in this one. Okay. All right, so 50% of you say with a partner I trust. Think about that. What does it mean, a partner that I trusted with that? Now, obviously, you see once, frequently, and never. You meet somebody, so you go out for X number of weeks or months or whatever. I trust this person. So what does that really mean? Okay, do you actually sit down with them and talk with them about, gee, their former sexual partners and who they were with? Okay, and a lot of you don't, right? Do you all go and get AIDS testing before you engage in sexual practices? Probably not. Okay, but you trust that person. Well, what do you trust them for? I trust you that you weren't with somebody else who was HIV positive. Well, how do they know? I mean, who knows who's HIV positive or not, because most people don't get tested. So you trust that person because they were in a committed relationship before. Now they're in a committed relationship with you. Well, that doesn't mean the person they were in a committed relationship was really committed to the relationship, and they may have been fooling around with somebody else. Okay, and you just don't know. But we have this adage that, oh, I'm with somebody who I trust, unprotected sex, but you just don't know. So, most people are going to tell you before you sexualize a relationship, both of you should go get tested, just in case. Okay? And then maybe you shouldn't be, in terms of unprotected sex. Maybe you need to wear a condom the first few times. When we look at this stuff, we ask people, what are some common excuses for not practicing safe sex? And there's all of those reasons that are there. Okay? A very common phenomena in a lot of residential universities, go down to A&M, UT, one of the things they do in residential halls is they always have the mandatory sex education talk. Everybody needs to come down and attend this seminar and things like that. And people listen to all this, and they show you how to put on a condom and on and on and on. Then they go back, that's usually in the fall semester, they go back in the spring semester, and they ask people, well, how many people have had unprotected sex? And what you get is a higher ratio of what we just got that's there. And the answer is, oh, but it's okay, I'm with somebody who I trust. Okay? Pretty scary stuff. Pretty scary stuff. Now, I do know that we have treatments for people who are HIV positive, very, very expensive, keeps them alive for a lot of years. That's all wonderful, but the percentage of people who are getting HIV and becoming HIV positive is still very, very high. So you all need to do some more serious thinking about this, because most of you are in an age group that says it can't happen to me. It can't happen to me. Well, it sure can. So need to watch out. I don't know where I was on that. Okay. All right, let's just go on. Number 4. Male transvestite, men who like to dress in women's clothes, usually are homosexuals. That's false, okay? That is false. I know some of you have been down to Oak Lawn for the Gay Pride Parade or the Easter Parade or the Halloween Parade, and you've seen various men dressed in drag that's there. Well, that's a certain percentage of the subculture of the gay population that may do that. But most men who get a sexual interest and get turned on, okay, by wearing women's clothes are usually heterosexual, and they're usually married as well. Okay? What winds up happening is that some of these men from early ages, okay, associate women's clothes with sexual turn-ons that are there. Most sexual dysfunctions, and this is what's important about this question, most sexual dysfunctions, whether it be impotency, premature ejaculation, vaginismus, anorgasmia for women is usually conditioned. They're usually conditioned. It's a learned behavior that's there. So these men begin to associate sexual pleasuring, sexual interest, sexual turn-on with women's clothing, and it just gets more generalized for them. Okay, so another one was menstrual monthly period cramps and pain usually have a psychological basis. You women just make that stuff up to bother us men. That's what it is. Okay, that's false, right? It's a physiological aspect for that. Some women never have any issues with this, right? Some women may get depressed, some may get anxious, may feel bloating, may get headaches, all different types of issues. Sometimes people have premenstrual, menstrual, or even postmenstrual issues that are there. You do know that the birth control pill, okay, was first developed not for birth control, but to regulate cycles and to reduce the effects of premenstrual syndrome like that. In fact, a lot of you women may have went on the pill when you were 14 and 15 and 16, not for birth control reasons, but more for regulating your cycles as well as reducing some of the side effects of that. Basically, it's the change in estrogen and progesterone that then increases changes within your body. Eggs from one ovary produce males and from the other females. False, right? Like there's a little sign in there that says one ovary is no. Matter of fact, the woman is really the one that's kind of stationary. She just produces female eggs, right? It's the man that's going to be the predictor of whether or not you're going to have a male or female child. Because the male sperm are they're either male or female. Either male or female. So when you have a female sperm, X, get together with a female egg, X, you have double X, which is the genetic program for female. If it's a Y sperm, male sperm getting together, female egg, it's XY, which produces a male. People also don't realize that male sperm are smaller but faster. Female sperm are a little longer and slower. There were more male sperm in the average ejaculate than female sperm. More male sperm die off once the man ejaculates into the woman's vagina. Okay? After that, well, let me tell you this story. Okay? This is the greatest story ever told, right? This is the story of all of our lives. Every single one of us, unless you were created in a petri dish or something. Okay? It's our story. Okay? In the average ejaculate, okay, in male ejaculate, there are over 200 million sperm. Okay? That's a lot of sperm floating around there, isn't there? Okay? So what winds up happening, the man ejaculates sperm into the woman, and get this, the woman's vagina considers male sperm one-cell invaders. Okay? So what happens here now is there's a major battle going on in there. Okay? The woman's immune system gears up and actually goes in there and actually destroys some of the male sperm. All kind of fights going on in there. Okay? Male sperm aren't the brightest creatures in the world. They're not really, right? One-cell organisms. But they try to fertilize any one-cell object that floats around. That's there. They do that. The woman's vagina is also highly acidic. Highly acidic. Okay? Since it's so acidic, it's going to kill off a lot of those sperm. So they're dying all over the place, being fought and eliminated, trying to fertilize. And then something kind of magical happens. It's really fascinating that this happens. So if I showed you this, okay, so what winds up happening, you see where the cervix is at the end of the woman's vagina as cervix. Right there, woman's vagina, the uterus. So it's the opening that goes from the vagina to the uterus. A substance called mucilin, okay, is when you're ovulating, will secrete from the uterus and come down into the vagina. And this mucilin is like a life-giving force, okay? It floats in there, and then all the sperm, if they can find the mucilin, will go into the mucilin, and the mucilin protects the sperm from the woman's acidity that's there. So what they wind up doing is then they swim up into the uterus. So now they're kind of free and clear of the acidity that's there, but the woman's body is still trying to destroy the sperm that occurs. Still trying to destroy. By the way, there are 20 million sperm, not 200 million sperm. Let me get that right. Got a zero in there, 20 million sperm. So 20 million sperm, who knows how many are left at this point. But then something else happens. As you see, there are, you don't see in this one, but there are basically at the end of the uterus, at the end of the uterus, there are two tubes, the fallopian tubes. And each one of those tubes are attached to, okay, an ovary. So what winds up happening, you have, when fertile, an egg is going to come out of the ovaries and come down into the tubes. So the sperm are still in the uterus looking for the egg. And then something else kind of magical happens. They actually split up, and half goes one way and half goes the other way. Kind of interesting. I don't know if there's a little captain in there that goes, divide up, 50 this way, 50 that way. And they take off, and they go in pursuit of the egg. One doesn't find it, right, because the egg is only going to come down one area. The other one finds it, unless there are fraternal twins and you have two different eggs. But you go back up. By the time the sperm make it to the egg, out of that 20 million sperm, there are only around 50 sperm left. It really is a miracle, okay, of life that we've even gotten here. Then what happens? That egg, that huge egg is turning, the little sperm get in there. One sperm gets in, deposits its genetic material, the egg closes up, then comes down the tubes, okay? And then, if pregnancy occurs, then it'll become implanted into the uterine wall. What also a lot of people don't realize is that close to 50% of all eggs that are fertilized are not implanted into the uterine wall. So 50% of the time, we might say, and you may not even know that, you may have gotten pregnant, I guess if you call it now. You have a fertilized egg, but it never became implanted in the wall and just was discharged the last time you had a menstrual cycle, and the uterus sloughs off and takes what's there off, and you menstruate that way. Really pretty incredible that we actually got here, isn't it? A real miracle of life that's there. I don't know why I got into that, but that just popped into my, eggs and ovaries, that's what it was we were talking about. By the way, more eggs that are fertilized are males. More eggs are implanted into the uterus that are males, but more males are miscarried than females. More males are born, but more males die during infancy than females. So we're the stronger sex, we know. Okay, we keep dying off all the time as you go through this. All right, let me just do one more, then I'll stop and we'll do that relaxation. The cause of impotence is almost always psychological in nature. Okay, and the answer to that is false. What is impotence? Impotence is the inability of a male to get an erection or maintain an erection. Either or, get or maintain an erection. And the answer to this question is really more age-dependent than anything else. The older the man, the more physical reasons we have. The older the man, as men get into their late 50s, 60s, and 70s, it's probably more physical. What are the physical reasons for it? In order for a man to get an erection, within the man's penis, okay, within the man's penis, there's something called spongi tissue. It's actually like a sponge that's in there, spongi tissue. In order for him to get an erection, blood has to flow into the penis. And when blood flows into the penis, the spongi tissue become what's called engorged, okay, and the man gets an erection that way. So as he gets older, if he has poor circulation problems, advanced problems with diabetes, he's taking some type of medication that's there, or just getting older and he has poor circulation, that may not allow the man to get an erection. So later on in life, it has more to do with physical reasons. But there's a little tiny pill, number 9, called Viagra, increases a man's sex drive, and that's false. Viagra does not increase a man's sex drive. Okay? What it does is dilate blood vessels. It opens up blood vessels. So when it opens up blood vessels, blood can then flow in. So when a man takes Viagra, it just doesn't work on his penis, it also works at every other part of his body. So if he has a tendency to be prone to heart attacks and cardiovascular problems, you don't usually want to give Viagra to somebody because that can increase other issues that's there for him. But that's what it does. A lot of people think it's for sex drive, but it's not. All it does is increase blood flow that's there. Now, for men in their 30s and 40s, most impotence has to do with psychological reasons, and the big factor here is stress. The big factor is stress. Do you remember the sympathetic part of the nervous system? And I made a joke at one time when I was going through all the symptoms. I said it reduces blood flow, it constricts blood flow, and then at the end of that overhead it said it reduces the man's ability to have an erection. And I made a little joke about that. You don't remember that. I said that basically he cannot get an erection when he's under a lot of stress. Okay, I won't tell you what the joke was, but okay, when he's under a lot of stress. So men in their 30s and 40s and early 50s, if they're under too much stress, sympathetic is always in gear, he may not be able to get an erection. Now for younger guys, like a lot of you guys, in your adolescent year, in your 20s and your early 30s, it's still psychological because of stress levels, anxiety, stress levels. But another factor comes in, and that's called alcohol, okay? And what winds up happening with alcohol, alcohol is a vasoconstrictor, okay? It constricts blood vessels. So if you've had too much to drink, okay, you still have the desire and the interest, but things may not happen because you're not getting enough blood into your penis. So here's what happens. Guys, guess what? Research tells us that sometime in your life you'll want to, but you can't. Okay? Hopefully it's not now, but sometime in your life this may happen. If so-and-so and so-and-so get together, okay? And what winds up happening is that they're out, they're partying, they're having a good time, they both drank too much, they stumble home, they decide to have sex, okay? They're kissing and hugging and doing everything else, and then it comes time for genital-to-genital intercourse or any other type of intercourse, and it doesn't happen. Most men, if they had too much to drink, are usually going to be what? Too embarrassed about that? They're not going to say, oh, well, I learned this in Dr. Link's class. I didn't have too much alcohol. They're just going to get too embarrassed and go, oh, and then they make believe they pass out, or they do pass out. Okay? Most females, again, by the way, for females, your clitoris also becomes engorged with blood. Okay? You have too much to drink. That may also affect you as well. So here's the female. She goes, I don't know what just happened, and she passes out. Okay, he wakes up in the middle of the night with an erection, which a lot of young men do. Okay, so he does, and he says, well, I was kind of upset before. Okay, and he wakes her up. Okay, and starts all over again, but he makes one big problem. He has one big issue. What's happening is a lot of the alcohol's out of the system, but it's not completely out. So it's still kind of constricting. And then he begins to think, boy, that was embarrassing before. Good thing I just kind of fell asleep. If this happens again, I'll be really embarrassed. What did he just do? He just induced the sympathetic part of the nervous system, which is automatically going to reduce blood flow again. And then it happens again, and he's, oh, I think I'll pass out again. And he makes believe again. And then the woman is going, God, what's going on? He doesn't love me, and is that what the problem is? Maybe I'm not attracted. And she doesn't say anything. Well, you know what you need to do? You need to talk about this. Okay? If you're a guy, you need to say, well, I had this class once with Dr. Link, and Dr. Link told me that I need to bring this up. I'm really embarrassed about this, but this has never happened before. Okay, and too much alcohol. Okay, now you, the female, if a guy is saying that, don't go, ha ha, look at that. Never been with anybody that ever happened with. No, you don't want to do that. You want to say, well, I was in Dr. Link's class once, and he told me these things are normal. This happens. When that happens, then maybe people can relax, and as they relax, then they'll be able to function again. Right? If not, what happens? You have something called conditioning. Remember conditioning? Except this time what happens, you're beginning to, it's a classically conditioned reaction. You're nervous, you're uptight, you have a physical reaction, you begin to pair up what? Not a bell and a whistle, but a woman, or whoever you're with. When that happens, then all of a sudden, without the alcohol, it becomes classically conditioned, and now you become impotent. Not good, unless we can talk about this. The end of your chapter, by the way, Masters and Johnson, who are the key people who have done all of this research on this, have treatments. They take long answers. So here we go. For a certain period of time, called the refractory period, after an orgasm, neither men nor women are able to respond to further stimulation. Okay? And that answer is true. Okay? Now, who is it? It's men, not women. Okay? But that is a true answer. Now, this is going to be a long answer here. Now, the researchers we need to know from this chapter, the names of the people we need to know are Masters and Johnson. Okay? William Masters and Virginia Johnson, okay, did all of the research during the 1960s on what happens physiologically when people have sex. And what they did at first, they brought people into their little lab in St. Louis, and first they had them masturbate. And what they did, they measured cardiovascular, they mentioned skin intonations, how long the orgasm was, how long the buildup was. Then they brought couples in, okay? They had prostitutes also come in, okay? And they did all their research. Really interesting research in the early 60s. This was a real no-no, that you were going to actually watch people have sex and record them. But they're the ones that did all the really interesting research on what happens during sexuality. And what they came up with was something called the human sexual response cycle. The human sexual response cycle. Anybody get Showtime? Anybody subscribe to Showtime? Nobody does? Okay. If you did, there's a series that they have going on called The Masters of Sex, and it's about Masters and Johnson and how their research came about and what they did. It's kind of a fictionalized account of it. But anyway, what they talked about, no matter if you're male or female, you go through these 4 stages, male or female. The first stage is called the excitement stage. The excitement stage can last for a few seconds, minutes, or hours. Okay? The excitement stage is just that. You're excited. Okay? What's happening physiologically is blood pressure goes up, heart rate goes up. Okay? What happens is that blood is sent to, for the man, the spongi tissue to give an erection. For a female, blood is sent to the uterus, as well as the vagina, as well as the clitoris. All of that is called the engorgement process. That's there. Okay? What happens is for men and women, as they're in the excitement phase, for a man, he's going to maintain an erection. As he gets close to the end of the excitement phase, to the plateau phase, what happens is erection gets very firm. For a woman, as she enters into the plateau phase just before that, she also has a process that she goes through called lubrication. And what lubrication really is when blood is sent into the vagina, and the vagina then what's called sweats, okay, which causes the lubrication for a woman. A woman at the end of the excitement going into the plateau will also begin to have what's called the tenting phenomena. Now, I'm not trying to be crude, but this is the best way I can explain it. The vagina. Okay, the tenting phenomena. What happens is here is that the woman's vagina as well as her uterus begins to tent up or rise up. that's usually an indication that the woman is getting into the plateau phase. Plateau phase is plateau, right? Blood rates, blood pressure rates, tenting phenomena is at the plateau. Okay, it's plateaued out. It's the highest it can be. Muscles begin to tighten up like this in the plateau phase. For a man, he also experiences maximum erection. His testicles also rise up during the plateau phase as well. This is a little crude, but what happens to the man's penis? It usually has a little curve at the end of it. It could bend to the left, it might bend to the right. They're all a little different. That's there. But the reason why it has a little bend into it, and the reason why a woman's vagina begins to tent up, I'm not going to do this, but okay, if you can imagine, what's happening here is the tenting phenomenon, the man's penis being that way, is going to maximize for fertilization purposes, because you're going to try to get the sperm as close to the cervix as possible. So if the tenting phenomena goes like this, it tents up, makes it kind of a straight shot for the penis and the sperm to be there. It's all about procreation, right? It's not necessarily about your pleasure, but it's about procreation purposes there. Plateau phase, plateau phase, plateau phase. Okay, right before that. Fingers begin to tighten up, toes begin to tighten up. This is the intense feeling both people have before they get to stage 3, which is the orgasmic phase. For a man has an orgasm, and the orgasm is contractions in the muscles, in his prostate gland, seminal vesicles, as well as within the penis. Okay, those messages are then sent to the brain to give him a feeling of what pleasure that's there, an orgasm. Female has an orgasm as well, centered on the clitoris, contractions in the clitoris, as well as the vagina and the uterus as well. For a man, he's going to ejaculate, orgasm. For a female, she may have an orgasm, and she may increase, okay, her flow of lubrication, and sometimes really feel that she has also ejaculated. For some women, that does occur. Now, here's the change that occurs. For a man, after he has an orgasm, he's going to hit what's called the resolution phase. The resolution phase is just that. Everything I talked about in terms of blood pressure rates, tightening of muscles, and everything else becomes resolved. It minimizes. It becomes reduced. Okay? For a female, she may go from excitement, okay, to plateau. If she went to orgasm, she may go to resolution. But for a female, she might go right back to excitement, plateau, orgasm, plateau, and orgasm. We say that some females can have multiple orgasms. Females may never reach the refractory period. What is the refractory period for a male where he cannot get another erection? Cannot get another erection. And the timing on this, how long does it take between the refractory period and him getting another erection, is age dependent. So if you're sitting there, guys, and you're 18 and 19 and you're 20 and you're going, I never went through a refractory period. I have an orgasm and I'm ready again. Okay? Well, that's because you're young, okay? But you do have a refractory period. It may be a minute or two. But as you get older, the refractory period increases in time. So when you're in your late 20s, it may be a few minutes. In your 30s, it may be 8, 9, 10 minutes. In your 40s, it could be 15, 20 minutes. In your 50s, it may be 30 minutes to an hour. In your 60s, it may be hours. And in your 70s, yeah, it could be a day or two. Okay? That's what the research says. That's there. For a female, though, she doesn't go through a refractory period. She can go excitement, plateau, no orgasm, resolution. She can go excitement, plateau, orgasm, excitement, plateau, that way. For some men, though, who are younger, excitement, plateau, orgasm, very quick resolution, and back again. But as the man gets older, that doesn't occur. Women, do all women have orgasms? No. Do all women have multiple orgasms? No. Okay? It's a matter of also training your lover also to tell you what you like and what you don't like. But Masters and Johnson were the first people who did research on all of this. really fascinating research to think that they brought people into their lab and watched them and then hooked them up to all these physiological devices. All right? Next question. Where was it? The one on Viagra we did already. There must be 2 acts of sexual intercourse to produce twins, 3 for triplets, and so on. Okay? That's false. But, there's a B-U-T here. But, all right? Twins, identical twins, is when there's one egg, right? Sperm and egg get together, and then that egg splits off. So you have identical twins, right? That are there. They look the same. However, fraternal twins is when there are 2 eggs get fertilized. So every once in a while, because it runs in families, a woman may release 2 eggs. Okay? Now, usually when you're having sex, there's 1 egg that's released, then very close in line, another egg is released. Sperm can stay viable within the woman. Some research says up to 48 hours. Some I've even read up to 72 hours that are there. So on Friday night, you're with person A. You have sex with person A. 1 egg is released Friday night, Saturday morning. That egg is fertilized. Saturday night, okay, you have sex with person B. And then all of a sudden another egg is released all of a sudden. 2 different eggs, 2 different acts, 2 different fathers, right? Fraternal twins being born. That'll be a surprise, isn't it? Particularly if those 2 different guys you were with might have been different ethnic groups that are there. That's a possibility. So in some ways, there's a but to this one, right? But usually that doesn't happen. Okay? Now, by the way, don't go home and say, Steve Link said, okay? This is very odd when that happens. So is this one. During sexual intercourse, a woman may suffer from vaginal spasm that's trapped her partner's penis and prevents us from withdrawing it. That's either every man's fantasy or his greatest nightmare, depending on his perspective that's there. Can that happen? Yes, that can happen, because the woman's vagina is a muscle. And since it's a muscle, it can have spasms. If it's a muscle, after you have the child, if it's a muscle, right, muscle gets expanded. If it's a muscle, it can be trained to bring back its elasticity that's there. They're called the Kegel exercises, by the way. Okay? Can this happen with men and women? Yeah, it might. Some women do have a certain illness, a disorder, not an illness, a disorder that causes some of this, but it's very rare. Other people think about other animals, okay, not humans. Every once in a while there's a story, you say, oh, my friend works at Parkland Hospital, and they brought in this guy and this woman, and they were stuck together, okay? That really doesn't happen, but it can happen with other animals, dogs, yes. Right? What happens is the head of the dog's, after he enters the female, the head of the dog's penis swells up, prevents him from withdrawing it until he ejaculates. So there you were at 7 years old, and your little doggy was in the process of, and you said, well, what's going on there? Okay, and your parents said, oh, don't worry about that. One dog is trying to push the other dog down the street. Okay, or you tried to do that. No, don't want to do that. So with other animals that may happen, but not usually with humans. Let's do one more. It is common for a person to become homosexual because of hormonal imbalances. What do you think? The reason why people are homosexual is because previous homosexual experience, hormones, genetics, brain traits, or you know what, they just are. And I'll give you the answer to this one. Just let me see your opinions. Isn't this a social issue that's changed dramatically in the last couple of years? Okay, what an acceptance we do have in the United States right now. All right, so what you're answering is 32% say they just are. Anyway, there's your answers. They're across there. Previous homosexual experience, I guess you might say that's conditioned, but not really. Okay? Most people, when you talk with them who are gay or lesbian, will say to you, it's just the way I am. Get this, from the first moment I had sexual feelings, my feelings were for someone of the same sex. There is no hormonal research that says that way. There's no genetics, although we do find that homosexuality does run in families, so maybe there is some genetic quality that's there. No brain traits in terms of hypothalamus and things like that. They just are. I think about myself, and I say to myself, all right, Steve, when was your first sexual experiences? What was your first sexual, not experiences, but feelings that you had? So I'm thinking back, maybe when I was like 5 or 6 years old, and I was watching a show, back in my day was the Mickey Mouse Club. Now some of you watched that when you were younger, and that's where Britney Spears was in it, and Justin Timberlake, and some of those women. But I was before that. And there used to be a woman on there, her name was Annette, okay? And she was the only one that had breasts, I think, okay? And so I used to watch that, and I still remember going, I like Annette. I like Annette. I like her. No, I'm 5 years old. I'm not sitting there going, yeah, Annette, she's mine. I don't. I'm 5 years old. I don't have those thoughts. But I have these feelings that are there. Well, someone who's gay or lesbian may be watching the same show and have that same feeling for someone of the same sex that's there. That's all it is. That's all it is. And that's all the research can tell us, is that they just are in that way. If you look at homosexuality across internationally, it's about the same percentage across the world. Now, some countries put people to death because of that, and they don't look like they have that many, but it's mostly in the single digits, just about in all countries, 4 to about 8%. All right, so